Welcome to Nursing 508 Module 2 lecture, where I'm introducing qualitative and quantitative research. Those are the two most common research methodologies, qualitative and quantitative, and we'll be discussing the similarities and differences between the two. We'll also discuss how to approach reading a research article, since you'll be doing a lot of that this semester. Quantitative research examines a single reality that can be objectively measured, such as a blood pressure or blood glucose, and attempts to identify a cause and effect. For example, a certain intervention causes a drop in measured blood pressure or blood glucose. In quantitative research, the findings are objectively measured, not a matter of perspective or context. Its meaning doesn't vary from one individual's perspective to another. It's black and white. The basic element of analysis in quantitative research is numbers. The reductionist approach utilized in quantitative research means that the smallest parts or measurable parts of a concept are studied. Quantitative research is typically based on a theoretical framework which guides the research process. Quantitative research is outcome oriented and generally most concerned about the results of the study. Control is an important aspect with quantitative research. Think of a laboratory environment where temperature, airflow, and other aspects of the environment are all controlled. Such is the attempt of all quantitative research. Potential outside influences, other than the variables being studied, are controlled so as to increase the likelihood that any impact found is the result of the variable or variables and not outside factors. Without such control, no cause and effect can be determined. In quantitative research, precise measurement of variables is of utmost importance. Measurement tools must be determined to accurately measure the variable that they are meant to measure. The aim of a quantitative study is to establish findings that can be generalized to a larger population. Statistical analysis is utilized in quantitative research to control error and support that the findings are not simply a matter of chance occurrence. These are the four categories of quantitative research. The type of research methodology utilized should be determined by the research question. For example, if your research question is how many people quit smoking after making a New Year's resolution to do so, then a simple descriptive design will answer that question. However, if you want to know if a specific intervention causes more of those people to continue to abstain from tobacco use, then a descriptive study will not answer that question. Qualitative research, unlike quantitative, is based on the logic that reality is fluid. It's different for each person and only has meaning within a given context. Words are the basic element of analysis in qualitative research. Qualitative research looks at the whole picture. The belief that there are multiple realities is firmly based on philosophical underpinnings. Understanding and discovery of meaning is the basis of knowledge in qualitative research. Control is unimportant in qualitative research. As the data collection process unfolds, the direction of a study may change. While accurate measurement is the gold standard in quantitative research, in qualitative research it is rich description of the concept or phenomenon being studied. There is no underlying aim of generalization with qualitative research. Depth of understanding rather than breadth is the aim. Qualitative research is process oriented. The rigor of qualitative research is commonly examined in terms of the trustworthiness of its findings. It is often said that qualitative research should be used for initial exploration of new concepts, and quantitative research should be used to measure what is found in qualitative studies. I believe, however, that almost every concept can be examined in both a qualitative or quantitative study. You can learn a great deal about a concept with either methodology. It is simply different types of information that you gain. These are some examples here. If you were looking at teen pregnancy, a quantitative question would be, what is the incidence of pregnancy among 13 to 18-year-olds in Idaho? Or another quantitative example are what health risks are associated with pregnancy among teens. Qualitative research questions regarding teen pregnancy could be something like, what is it like to be a pregnant high school student in rural Idaho? Or what social supports do pregnant high school students experience? Again, any of these questions would give you insight into teen pregnancy. And by completing both quantitative and qualitative research on topics, the knowledge that we gain, I believe, is much richer. This is an example here on this slide again of how both qualitative and quantitative research can be utilized with the same research question. With the qualitative approach, your number of participants, also known as sample size, or N, is how you'll see it written a lot of times, is going to be much smaller, but the depth of understanding may be deeper. The teens that you interview may identify a reason that you were not aware of and didn't include on your survey. On the other hand, with the quantitative approach, you will be able to get data from a much larger sample, and so your findings will be more generalizable. There are pros and cons to each approach. It simply depends upon what the researcher's purpose or aim is. Now we're going to switch gears a bit. Since we've discussed different approaches to research, and you've already seen some examples in your text, and also hopefully on this week's readings, I thought we should discuss the basics of how to read a research or evidence-based practice article. Oftentimes, you can tell a lot about a study by simply looking at the title. The title usually identifies the topic that was examined and may identify the type of methodology utilized as well. The abstract is a very brief paragraph or two that summarizes the entire study and its results. If you skip down to the discussion section, you can get to the meat and potatoes of the study to find the results of the study and their implications. You can usually tell if a study is going to be one that you want to explore in more detail or not simply by reviewing these three sections. This is a list of the common aspects covered in a research or evidence-based project article. We'll review each section in a bit more detail here. Most articles begin with a description of the topic being explored. The authors typically give a bit of background on the issue. Most will briefly review the research that has already been done and outline the current knowledge. Gaps in the current knowledge are typically presented as support for why the study was undertaken. The research or evidence-based practice clinical question is then identified. Sometimes a hypothesis rather than a research or evidence-based practice clinical question is presented. The difference between a question and a hypothesis is that the hypothesis presents an anticipated outcome as demonstrated in this example here on the slide. The question being, what is the effect of early ambulation on length of stay, versus a hypothesis where you're stating what the anticipated outcome is patients who perform early ambulation will have a decrease in length of stay. There are also differences between research question and evidence-based practice clinical question. Research question typically looks at the effect of a specific intervention, whereas an evidence-based practice question is looking to find what intervention is supported by the best available evidence. For example, in this one, research question would be, what is the effect of providing smoking cessation literature at each clinic visit? And an EBP clinical question might be, what is the most effective way to encourage smoking cessation in an outpatient clinic setting? Variables are a research concept that many people struggle with. In research, at least in quantitative, you're frequently looking to see what effect an intervention or action has on an outcome. The intervention or action is the independent variable, and the outcome being measured is the dependent variable. For example, if you were looking to see if regular yoga practice lowered blood pressure, then yoga practice would be the independent variable and blood pressure would be the dependent variable. Some research articles will explicitly state the independent and dependent variables, but some do not. Sometimes you have to kind of figure that out from reading. When reading a research article, you'll want to determine what research design was used for the study. Different designs are used depending upon what design would best address the question being asked and what the goals of the research are. Descriptive and correlational studies center on describing variables, exploring relationships between them, and enhancing measurement of variables. Quasi-experimental and experimental designs typically involve control groups and look to identify cause and effect. The research design chosen will determine the population, sample, data collection, and data analysis processes. Study participants are chosen based on many factors. Obviously, if you're studying the effect of an intervention on a particular disease, then you'll want your sample to be made up of people who have that disease. There are multiple sampling methods outlined in the text. When reading a research article, identifying the sample and sampling methods utilized will help you to determine if the sample is representative of the larger population and if the population of study is similar to your own patient population. When reading a research article, the data collection method should be described. The authors should outline whether the data collection was done in person or via mail or electronic communication, as well as what tool was utilized, for example, a survey, a questionnaire, or an interview. Depending upon the type of study, the results section of a research article may address these aspects of the study's results. The authors will also frequently discuss strengths and weaknesses of their study, as well as recommendations for future studies. When you have finished reading a research article, you will want to pause and ask yourself, so what? Was the study worth doing? Does the study provide you with useful knowledge? Was the study performed appropriately so that the conclusions can be trusted? Will the results inform your practice with your patient population? These are the questions that you'll want to ask yourself. You will not, however, want to make practice changes based on one research article. You'll want to look at an entire body of knowledge on a subject before you draw conclusions. In order to draw appropriate conclusions, you will need to become adept at reviewing and analyzing research and evidence-based practice literature, which is what you will do this semester. We've covered a lot of information. Most of it should be vaguely familiar from your undergraduate research course, but if it's been a while, then it may be very vague. Try not to be overwhelmed. Throughout this course, you will be seeing a lot of examples of research articles and EBP articles, both quantitative and qualitative research, and you will become much more comfortable with the process as you are exposed to more and more examples. So hang in there and be sure to take the time to do the readings and review the various examples that I have posted in the module readings each week. Thanks.